Hello, today we will be discussing heart valves. Our heart has basically four valves, and these can be classified in two ways. The first being the atrioventricular valves, and the second being semilunar valves. Both of them are two in number. The atrioventricular valves are namely the tricuspid valve and the bicuspid valve. Now, the tricuspid valve and the bicuspid valve, these are named because this tricuspid valve has three cusps, while the bicuspid valve has two cusps. The tricuspid valve is present between the right atrium and the right ventricle, while the bicuspid is present between the left atrium and the left ventricle. The semilunar valves are also two in number, but they are present between the right ventricle and the pulmonary trunk, this one. So basically what happens is when blood flows from the right atrium into the right ventricle and then to the pulmonary trunk, these semilunar valves are present to guard the pulmonary trunk. The other set of semilunar valve is present between the left ventricle and the aorta, right over here. So this is basically the two semilunar valves. But what are valves? Valves are basically structures that maintain a one directional flow of blood through the heart. As you can already see in the diagram in the left, the flow of blood through the heart has been depicted through the through arrows like this. And between the junction of every between the atria and the ventricles, there is a valve that aids in this process. The valves directly do not push the blood. They do not push the blood, but they actually help the heart to function effectively as a pump rather than a mixing chamber. So what happens is when when the atria and the ventricles contract, the pressure inside the chambers increase. So for instance, during ventricular contraction, the pressure between inside the ventricles, that is the right ventricle and the left ventricle, they increase, and they are more compared to the right atrium and the right ventricle. And remember that this is the case of ventricular contraction. So what happens is when the pressure is increased, the semilunar valves, they open up. These open up, both of these, and this allows the ventricles to pump the blood effectively into the pulmonary trunk and the aorta. So these two valves are working. Also, the atrioventricular valves are also instrumental in this case, over here and over here. What they do is these cusps contract, and what happens is they prevent the backflow of blood. They do not allow the backflow of blood. If there had been any backflow of blood, the ventricles wouldn't have been able to pump the blood efficiently. Now let's take a closer look at these valves. What we have here is the inferior view of the heart. From the inferior view, you can clearly see the four valves, and these two here are the semilunar valves, and these two here are the atrioventricular valves. The semilunar valves, they look alike. However, you can see a major difference between this and this, the atrioventricular valves. This one is the bicuspid valve, and this one is the tricuspid valve. The bicuspid valve is also called the mitral valve. The mitral valve, as we know, is present between the left atrium and the left ventricle, while the tricuspid valve is present between the right atrium and the right ventricle. And here you can see from the color of the vessel, this is the pulmonary trunk and this is the aorta. Now what we have here is a schematic representation of how the AV valves look. Now you might be wondering what this is, this view. This is basically if the atrioventricular valves were opened up by a slit. So over here, like this, or any place, you can do it over here or here, doesn't matter. So basically you cut open the AV valves through the vessels, and this is the view you get after opening it up. So as you can see, there are a few components to this. First of all, you can see a fibrous ring. What this fibrous ring does is it anchors the valve and maintains the shape of the AV orifice. Then we have the cusps. The cusps are the most important part, and they are the actual flap-like structures that open and close in response to the pressure differences. Then you can see these white threads. These are nothing but the chordae tendineae. The chordae tendineae are fibrous cords that tether the cusps to papillary muscles. What they do is they basically prevent excess upward movement. More on that later. And lastly, we have papillary muscles. These papillary muscles are ventricular muscles that are present on the walls of the both the ventricles, and they contract during systole and stabilize the valve rather than opening or closing it. As we know, in ventricular diastole, what happens is the atrial pressure increases, so there is a flow of the blood from the atria to the ventricles, and this is when the valves open, the atrioventricular valves. But in case of ventricular systole, what happens is, as we already discussed, the ventricular pressure rises. There is a chance of backflow of the blood, so the valves close. But what is the role of these papillary muscles and the chordae tendineae? Now there is an increased pressure, we know, and we know the blood is pushing against these valves. So there is always a tendency for the valves to open on the other side. This is prevented by the chordae tendineae, which are held to its place by the papillary muscles. Now the structure of the semilunar valves is pretty interesting. Just like the AV valves, this is the anterior view of the valve, and what we have done is that we have cut open the vessel through a slit like this, and this is the anterior view you get. First things first, this is the wall of the ascending aorta. This is the inside part you are seeing. Just below this, you can see there are three cusps. These are the cusps of the semilunar valve. And suppose these cusps are attached, the walls of these cusps are attached to the aorta. So you can imagine that there is a space created over here. These spaces are called sinuses. These sinuses basically store blood, and we will discuss more about it just after a while. Another component you can probably spot are these two things. We have already discussed about these. These are nothing but the right coronary artery and the left coronary artery, and they have a very interesting correlation with the semilunar valves. Finally, if you can see here, there are small nodules. So these are nodules, and these nodules actually are small thickened areas at the center of the free margin of each cusp, and these help to complete the closure of the valve. Now suppose this is the inferior view of the valve, and these are the cusps. As you can see, there is a very small portion that is still unguarded, so blood might pass through them. So what happens is, at the middle of these cusps, we have these nodules which ensure that there is complete closure of these valves. Now, there is something interesting I want to share about the semilunar valves and their correlation with the coronary arteries. So, what happens is when the ventricles contract, these valves open, and there is blood that is gushing from the ventricles into the aorta and the pulmonary artery. But let us take the case of aorta for now, which is depicted in this diagram. So, what happens is that there are the right coronary arteries and the left coronary arteries that emerge from inside the sinuses. The right coronary artery develops from the right aortic sinus, and the left coronary artery develops from the left aortic sinus. These sinuses store blood. How do they store blood? So when after the ventricles complete their contraction, there is a tendency for the blood to flow back. And what happens is just after these cusps have closed, that is basically the valves have closed, there is a little backflow of the blood into these sinuses. So these sinuses are now blood filled. Now, as we know, the origin of the RC and the LC are from the sinuses. The blood from them actually drain into the right coronary artery and the left coronary artery, and that is how the heart receives its blood supply. Now, before I conclude, I want to share one more interesting fact about these valves. I'm sure you've seen doctors carry around a stethoscope. Well, more often than not, it is to hear heart sounds. Usually, there are four types of heart sounds: the S1, S2, S3, and S4. But for simplicity's sake, I am classifying them into two types right now. More about heart sounds in a later video. So, how do you think these S1 and S2 are formed? It is very simple. It is basically S1 is formed when there is closure. There is closure of the AV valves. And S2 is formed when there is closure of the semilunar valves. AV valves are closed when there is ventricular systole, and semilunar valves are closed just after ventricular systole ends. This is before ventricular systole starts, and this is just after ventricular systole ends. So we have come to a conclusion of this video. Thank you for watching and have a nice day.